Good afternoon. Welcome and thanks for joining us for this webinar on the Walk Cares Fund. We'll give it another minute here just to allow folks to join, and then we'll go ahead and get started. But thank you for joining us. All right, looks like we had several more people join. So we'll go ahead and get started here. Again, thank you for joining us for this webinar on the Walk Cares Fund. Today we'll be covering Walk Cares for employers. And we do have language interpretation available in multiple languages. So you can hear a live interpreter by using the interpretation button at the bottom of your screen. So my name is Sebastian Kai. I am the Outreach and Language Access Lead here at the Walk Cares Fund. And I am joined by Sam, who is our Communications and Marketing Manager. Logan is our Outreach and Language Access Lead, and also Ryan Williams, the Employer Reporting Supervisor from the Employment Security Department. So together we'll be hosting today's presentation. The DSHS customer care team will be answering questions in the Q&A function during the presentation, and they'll be joining us later for the Q&A portion of the webinar. Anyone who has joined us on a computer or using the Zoom app on their phones can submit their questions through the Q&A function at any point in the presentation. And if we are unable to answer your question during this allotted time, you can submit your question using the Contact Us form on our website. This webinar will be recorded, and the recording, along with the slides, will be available on our website, wcaresfund.wa.gov/webinars within 24 hours of the completion of the presentation. So with that, I'll go ahead and get started and start sharing a little bit about what long-term care and caregiving is. So long-term care is help with activities of daily living, and that includes bathing, eating, moving around, and managing medications. It doesn't include medical care, so things like doctor's visits and treatment for medical conditions. And long-term care isn't just for older people. It can also help younger people with disabilities, injury, or severe illness as well. And a lot of people think long-term care means living in a nursing home or assisted living, but it also includes in-home care as well as some other services. Walk Cares covers in-home care and many other services like home modifications, home delivered meals, all to help you live at home as you age. In-home care can support mental and emotional well-being, in addition to physical support. A 2025 study showed that home care significantly reduced people receiving care's symptoms of depression. It also improved their quality of life and lowered their risk of loneliness. So with the right support, most people with long-term care needs can keep living independently, in their own homes. It's also very common for family caregivers to not realize that they are a caregiver. So you might go to your mom's house a couple times a week to cook meals, drive her to appointments, and make sure she's taking her medications, all of which are common care activities. And the majority of this type of care is provided informally as unpaid care, right? From a family member, it could be a friend or a neighbor as well. And we're all at a high risk of needing long-term care. So about 70% of us will need long-term care at some point in our lives. And that risk also comes with a high cost. As we can see, Getting 20 hours of home care each week for 6 months costs about $23,000 total. And even if you have a family member to be able to provide that care, it's important to keep in mind that the devastating financial impact that family caregiving can have on them as well. And like we mentioned, because long-term care is not medical care, it's not covered by health insurance or Medicare, except in some very rare circumstances. And it's typically only covered by Medicaid after you've spent down your life savings to just $2,000. And the reality is that paying for long-term care is a problem faced not just by lower income families. Most of us don't have enough retirement income and savings to live comfortably, and much less to be able to cover, right, those high costs of long-term care. So even if you do have some retirement savings, right, very few people have really enough to get by. We know that 41% of Washington workers near retirement have no projected retirement income from a pension, a 401k, or IRA. And then another 42% have no pension and only enough 401k or IRA savings to replace just less than 10% of their pre-retirement income. That means, though, that over 80% of us don't have enough savings to pay out of pocket for the care as that we may need as we age. So a public insurance program like WalkCares gives workers a more affordable way to pay for their long-term care needs by allowing them to contribute while they're working and while their incomes are higher. Then they'll be able to access money to pay for the care that they need later in life when they're on a fixed income. And covering all workers also helps keep contributions low. And then once you retire, your contributions stop. This approach to paying for long-term care is also more affordable than private insurance at the time when people access care. And unlike private insurance, which typically requires that you pay out of pocket for 90 days before you can access your benefits, WalkCares has no deductible or waiting period. And this is really especially critical because our population is aging rapidly. So that is what we can see here on this graph. Really just to focus on the red line there, the one that stands out the most perhaps, which is the population between or 85 and older. And that population group will quadruple from 2025 to 2050. What we see here is also the declining number of potential family caregivers. Those are folks between the ages of 45 and 64 to adults who are likely to need care. So people ages 80 and older. So that ratio, as we can see, is declining from 7 to 1 back in 2010, down to 3 to 1 in 2050. And many people think, even if they aren't going to be able to pay for long-term care as they age, that they'll be able to rely on their kids maybe to take care of them. And that may be true for some families today, though those caregivers do experience some significant financial and health impacts as well. But in the future, most older adults won't be able to rely on that family caregiving really as an option. Those family caregivers will also be more likely to be providing care for multiple loved ones at a time, maybe kids as well. So, for example, today someone in their 50s might be caring for one of their parents or their spouse's parents. But 20 years from now, someone in their 50s would be caring for two or more older adults. And even when there is a family caregiver, available, that care isn't actually free. So many family caregivers have a related financial setback, and on average, they spend about 26% of their own income on care-related expenses. And while caregiving can be a deeply rewarding experience, it's also important to recognize that it can also be stressful. So almost a quarter of caregivers say that their health has worsened since they took on their role. It's also really common for caregivers to leave the workforce early to provide that care. And caregivers 50 and older who do this lose an average of more than $300,000 in wages and benefits combined. And workers' care responsibilities can also have a big impact on employers. So most family caregivers work full time on top of their care responsibilities, and more than 60% say that it has impacted their job in some way. So that can include things like having to go in late more often, leaving early, using up their paid time off to provide care. Many also have to reduce their hours or even quit, right, their job entirely. Care responsibilities can also mean maybe turning down a promotion or even receiving warnings about performance or attendance. And you may not even know that your staff are struggling to balance both the care and their work. About a third say that their boss isn't aware of their situation. And caregiving can be incredibly stressful. So almost a quarter of caregivers say that their health has worsened since they took on the role. And now I will pass it off to Logan to start us off with the program overview.
Awesome. Thanks, Sebastian. So yeah, now we'll talk about the program itself. So with these challenges in mind, the state legislature began a search in 2014 for a public policy innovation that would do a few things. One, limit the impact of increasing Medicaid costs on all the taxes that we pay. Two, offer affordable long-term care insurance coverage that provides financial relief to those middle-class families. And then three, be financially sustainable and viable over the long run as well. And so the committee tasked with these challenges spent several years working with stakeholders, policy experts, actuaries to explore both those private and public solutions. After extensive research on both of these approaches, the findings were very clear. A program like the Wild Cares Fund that covers everyone, similar to Social Security and Medicare, is the only way to provide affordable coverage for all. Public pension, health care, and long-term care insurance programs where all workers participate have been successful throughout the world. And this approach keeps the contribution rates low, ensures coverage for everyone regardless of their age, gender, or health status. After considering a variety of options in 2019, the legislature passed a law, therefore creating the Wild Cares Fund. In 2022, the legislature made improvements to the program's coverage and benefits. Workers began earning benefits in July of 2023. In 2024, the legislature gave workers also the ability to take their Wild Cares benefit with them out of state. Last year, the legislature also created
Logan,
a market. Go ahead.
can you say 2024 again, please?
Yeah, go ahead. In 2024, the legislature also gave workers the ability to take their benefits with them out of state as well. And then last year, the legislature also created a market for supplemental private insurances policies that really work seamlessly with the Wild Cares Fund. This market is expected to go live by early 2027. They also gave workers who currently have a private insurance exemption a window to join Wild Cares. In July of this year, the benefit will become available for those that qualify. Go to the next slide. To earn benefits, you automatically contribute 0.58% of every paycheck during their working years. Only contribute while you're working. Everyone's covered the same low rate regardless of pre-existing conditions. Starting in May, you'll also be able to apply for benefits. You'll need to meet a contribution requirement and a care needs requirement. Once approved, you will get to choose on how you want to utilize that $36,500 benefit. That is a lifetime benefit amount that will continue to grow over time with inflation. You can also choose any covered services that you want. There's no out-of-pocket costs when it comes time to need care. We pay providers directly for services that you receive with no copays or deductibles. Next slide. And so this is what contributions will look like over the course of a career. That typical worker making around $59,000 a year, they'll pay $29 in contributions per month, which adds up to around $10,000 over a 30-year career. To earn less in benefits than you contribute, you would have to make on average around $210,000 each year for 30 years. Go ahead, next slide. Everyone who is contributing to the Wild Cares Fund more than 500 hours per calendar year is earning benefits. So this includes those part-time, temporary workers are included as well. To qualify for benefits, you have to meet the contribution requirements through one of the three pathways. First is what we call the permanent pathway. This will earn the full benefit amount by contributing to the fund for at least 10 years. Secondly is the temporary pathway, and this will earn the full benefit amount if you've contributed to the fund for at least 3 of the past 6 years at the time that you apply for benefits. And then lastly, the transition pathway. This will earn you the lifetime access to 10% of the full benefit amount for each year that you contribute if you're born before 1968. These workers can also earn the full benefit amount if they choose to qualify through another pathway. So for example, if you work and contribute that 500 hours per year for 2 years, you'd earn around 20% of the full benefit amount, which is around $7,300. Next slide. To use your benefits, we must determine that you need help
Logan,
with at least.
can you go back to
Go
the
ahead.
previous slide, please? This is one of the interpreters.
Sure.
Can you say the very last part again and slow down just a little bit?
Sure. Yeah.
Thank you so much.
Yeah. So the last bullet point here is the transition pathway. This will earn lifetime access to 10% of the full benefit amount for each year that you contribute if you were born before 1968. These workers can also earn the full benefit amount if they qualify through one of the other pathways. So, for example, if you work and contribute that minimum of 500 hours per year, pay into the fund for 2 years, you'd earn 20% of the benefit amount, or just around $7,300. Go ahead, next slide. To utilize your benefits, we must determine that you need help with at least 3 or more activities of daily living. It will contribute, and you will need at least help for at least 90 days. These activities that we assess are bed mobility, transferring, toileting, mobility, eating, and medication management. We also understand that cognitive limitations can affect a person's ADLs as well. So the care needs requirement was developed to ensure that also includes individuals who need assistance due to cognitive impairments, needing supervision, cueing, or reminders. Next slide. When you're ready to apply for benefits, you'll start by creating an online account. You can have someone else help manage your account. Your local area on aging will also be available if you need more support. Once you submit your application, we'll confirm that you've met the contribution requirement. Then you'll be able to schedule an appointment to talk about your care needs. After we've met with you, we'll let you know if you're approved to start utilizing your benefits. Next slide. Once you've been approved, you can utilize your benefits to receive any covered services supports from a Wild Cares Fund provider. You may want to choose services that help you stay safely in your own home, like in-home care, home modifications, home delivered meals, or adaptive equipment technology. We also cover many services that supports family caregivers. You can get paid from a loved one, even from your spouse, or you can get respite care so they can take a break. We cover education and consultation to help them manage your care, dementia, or behavioral supports, care transitions and coordination to support you when you leave a facility like a hospital. You can also choose to receive services in your own community, like an adult family home or adult day services. Or you can choose to receive care in an assisted living facility or a nursing home, including memory care. Go ahead, next slide. You might be wondering how far your benefit amount will go. About a third of people need care for just a year or less. For those people, depending on services that choose, the Wild Cares Fund may be able to cover all or most of the care that they need. For others, Wild Cares Fund can provide your family with immediate financial relief and time to plan for future care costs. Here on the slide are a few examples how someone might utilize their benefits. If you'd like to pay a family member to care for you. You can receive care for 10 hours per week for 2 years. You get care supplies for around $35,000. If you want to make your home more accessible to keep living there independently, you can make home modifications, install a personal emergency response system, get meals delivered for 3 years for around $36,000. If you need short-term help after an accident, you can get in-home care for 20 hours per week for 6 months, install a ramp, buy safety equipment for less than $29,000. Next slide. And starting in July, you can choose to continue participating in the Walk Cares Fund even if you do leave the state of Washington. To become an out-of-state participant, you must contribute to the fund for at least 3 years, work that minimum requirement of 500 hours or more per year, and must opt in within a year of leaving the state of Washington. Like other workers, out-of-state participants will keep contributing to the fund during their working years, and we are working on a process for out-of-state participants to report their earnings, pay premiums, really with a focus making it easy as possible for those individuals. Starting in July of 2030, out-of-state participants will also be able to access benefits outside of the state of Washington. Next slide. The Walk Cares Fund is a cross-agency program, so multiple state agencies have a role in this. The Department of Social and Health Services will process your benefits application, determine your care needs, also manage provider registration. The Employment Security Department manages exemptions, works with employers, and processes opt-in requests. The Healthcare Authority handles provider payment. The Office of the State Actuary is responsible for ongoing financial analysis. This time, I'll turn it over to Ryan.
All right. Thank you, Logan. Good afternoon, everybody. My name is Ryan Williams, and I'm the Employer Reporting Supervisor at ESD, and I'm going to go over some employer responsibilities, and we'll talk about some exemptions. So, employers have really three main responsibilities. That is to manage exemptions, withhold premiums, and report and pay quarterly. Employers don't contribute, but they will maintain a record of exempt employees, collect premiums, and also report employee hours and wages and remit premiums to Employment Security Department quarterly. We do want to note that the definitions of employer, employee, and remuneration are consistent with paid family and medical leave. And as well, the definition of wages also applies. However, it excludes the Social Security cap. So the Social Security cap does not apply with the Walk Cares program. Next slide. Employee exemptions. So the permanent exemptions, the private insurance exemptions, the law states we can't accept these applications after December 31st, 2022. And there were no exceptions to those dates built into the law. A new bill, Senate Bill 5291, was signed into law May of 2025, and that made some changes to the Walk Cares exemptions effective 1/1/2026. And I'm going to be outlining those changes in the next few slides. Also, individuals who have existing permanent exemptions because they attested that they had private long-term care insurance may rescind their exemption and participate in the program. Those individuals must notify Employment Security Department that they wish to rescind their exemption, and they can only do so from January 1st, 2026 through June 30th, 2028. Employment Security Department is required to consider partial years worked towards qualified individual status if the rescission happened mid-calendar year. Next slide. There are still some conditional exemption pathways that we do have listed on the slide here for everyone. And employees have 90 days to inform employment security and their employers once they no longer qualify for their conditional exemption. The circumstances under which their exemption must be canceled by notification to employment security and their employer are their spouse or registered domestic partner is separated from military service, or the marriage/partnership is dissolved, their immigration status changes and they become a permanent resident, or they change their permanent residence to within Washington. Also, individuals who hold non-immigrant visas for temporary workers are automatically exempt unless the individual notifies their employer they would like to participate in the program. And we do want to note further that active duty members of the U.S. Armed Forces performing off-duty civilian employment as an employee of an employer may apply for a voluntary exemption. The voluntary exemption must be discontinued by the applicant within 90 days of discharge or separation from military service. So, for example, it could be an active duty member of the Army who works as a waiter at a local restaurant, civilian employment. They may apply for a voluntary exemption. Next slide, we're going to talk about managing exemptions. So it is the employee's responsibility to apply and, if approved, to provide a copy of their approval letter to all employers. That's current and future. Once notified of an employee's approved exemption, the employers must keep a copy of their employee's approval letter on file, and then also stop deducting WACARE's premiums from those exempt workers. So you'll want to make sure that when you report those employees that you're marking them as exempt. Further, employees aren't entitled to a refund of premiums withheld before their approved exemption was effective or before they provided their approval letter to their employer. And we do want to note here that the effective date that we're speaking of, that will be in the letter. And once the employee provides the approval letter and the effective date of the exemption has passed, you must stop withholding the premiums. If the employer continues to withhold premiums, the employer must return the premiums to the employee. And again, employers are not required to stop withholding premiums until they receive a copy of the letter from the employee. And now we'll talk a little bit about premium withholding. WACARE's premiums for employees are calculated at a flat rate of 0.58% of the employee's gross wages, and this does exclude tips. as we mentioned previously, the Social Security cap does not apply for WA cares, and employers do not contribute to it. And once again, Washington employees must participate in the program unless they have an approved exemption on file. And of course, to reiterate, this is on an individual basis, and the employee is required to provide that letter to you, the employer, with the effective date on it before you stop collecting those premiums. Okay. Quarterly reporting. So you file for both programs with the same report. So you're going to submit one report for both the paid leave and the WA Cares program. There's no need to create a new account or file a separate report. You'll just use your existing Secure Access Washington, or SAW account, as we call it, for reporting and remitting the premiums. You can see on the right side, we do have the general reporting requirements, and then what we're going to need for each employee. And starting back in Q3 of 2023, in addition to providing the employee's wages and hours, we need the employee's date of birth and that WA Cares exemption status. And on that report, in order to indicate if they are WA Cares exempt, there's going to be a yes option, a no option, or the field is blank. So if there is not a yes or no and the field is left blank, then we assume they are participating in WA Cares and will assess a premium based on those reported wages. So it's really important that you do have, that you mark them if they are exempt, that you put a yes. And then also beginning with the Q3 2023 reporting period, we had new file specifications, and that incorporate everything required for WA Cares. And information on all of our current reporting specifications that can be found on the paid leave website. That is paidleave.wa.gov. And we'll also provide that for you a little bit later. Filing methods. The method that you can use to file your report is determined by the number of employees you are reporting for. You can only report manually for up to 50 employees individually. If you do have more than 50 employees, we require a file upload. We do have a CSV template and filing specifications on our website, paidleave.wa.gov. And you can also test your file before submitting it. But please make sure that you remove all identifying employee data, because this is not a secure part of the site like it is in Secure Access Washington. And what you'll do is you'll choose the year and quarter of the period that you are reporting for, and then select the radio button for the type of report that you would like to file. For example, no payroll, file upload, or manual entry. And we do want to point out that if you had no payroll to report for a quarter, this is where you would report that you have no payroll, because as of Q3 2023, you are required to file a no payroll report, even if you don't have wages in that quarter. Payments. Payments for WA Cares and paid family medical leave must be made separately. The payments go into separate funds and they're processed by different payment processing vendors. So to put it simply, one report, two payments, and we can accept check, money order, ACH, or credit card. Payments made via check or money order for WA-CARES are mailed to a different address than payments for paid leave. So it's really important that you utilize our payment coupon when submitting a check or a money order, and make sure that you're mailing it to the mailing address on that coupon. You can download the payment coupon with the mailing address after selecting the Pay WA-CARES Premiums button. And again, please include the coupons with the check and double check the address that you're mailing it to. And if you do notice that your payment was applied to the wrong account, no problem. Please call us or email us and we can request to have that payment transferred, and we'll provide contact information momentarily. And finally, WA-CARES and paid leave premium payments process at different times. Again, they're different banks. So even if you make it on the same day, the confirmations may look a little bit different. Again, that's because they are different payment vendors. And we just wanted to highlight a few resources that may be helpful. Here's a few of the links that we've talked about so far where you can learn more about employer responsibilities, exemptions, and reporting. So we've got wacaresfund.wa.gov/employers. That's for WA-CARES employer information. For employee exemptions, you can go to wacaresfund.wa.gov/howitworks/exemptions. And for WA-CARES and paid leave reporting, you can go to paidleave.wa.gov/reporting. Email updates. You can sign up for our mailing list to be notified when new materials become available and receive other program news, updates on webinars. Employment Security Department, we have a fantastic employer newsletter that provides monthly updates on WA-CARES along with the paid leave and our unemployment insurance. So the links to subscribe are included here in the slides, which I do believe are going to be posted for you all. And you can certainly visit our websites for more. And then finally here, on our last slide, we've got our phone number here, so you could give us a call for any questions about employer reporting or exemptions, or you can contact us by email. So you'll want to send an email to paidleave@esd.wa.gov. And to get you to the right team, if you're going to send us an email, please include the word UBI followed by your 9-digit UBI number. Or please put the word business followed by your business name in the subject line. And that will help us to get your email to one of our employer specialists, and it'll just be a lot quicker for you to get a response. And that is all I have. I believe I'll pass it back to Sebastian.
Thank you, Ryan. And I think now we're gonna move on to the Q&A. I think, Sam, do you want to?
Yeah, sure. So we're gonna move to the Q&A portion of the webinar. We have about 10-15 minutes to answer some of your questions. You can add them into the Q&A function at the bottom of your screen, and we will go through them. Sebastian, can you clarify what care coordination is, or do you want me to take that one?
Um, yeah, do you mind taking that one? I guess I'm a little confused on when
Yeah.
that came up.
So care coordination is support. It's designed to support your recovery when you leave a hospital or a nursing home. It's available for up to 2 months after you return home, and it includes things like making sure that you understand instructions that you were given from a medical professional, that you know how to take all of your prescribed medications when you that you were prescribed, and that you have all follow-up appointments set up, like x-rays or tests with your healthcare team, and all of those are set up when you leave. The next question is, how do employers know whether their employees are exempt based on a non-immigrant visa? Previously, we received an exemption letter from the employee. If they met this exemption, is that still the case? Ryan?
So now they're automatically exempt beginning, and I need to pull, I believe that was beginning 1/1 of 2026. So the non-immigrant visa holders are automatically exempt.
Great. Sorry. Sebastian, since people haven't contributed for 10 years, is it true that nobody is qualifies for the permanent pathway yet?
Right, yeah, that's correct. So because that pathway requires at least 10 years of contributions at any point in someone's career, we won't start seeing folks qualify through that pathway until 2033 initially. But of course, folks can begin qualifying through the transition and the temporary pathways July 1st this year.
We have a question about a recording and slides being available. The recording, along with the slides, will be available on our website at wcaresfund.wa.gov/webinars later this afternoon. Um, sorry. How do oh, sorry, you did that one. Can an employer pay the premium on behalf of their employee? Ryan, I think that's for you too.
Sure. Yes, and same thing with paid leave as well. Employers may choose to cover their the premiums for their employees. Yeah, absolutely.
Ryan, are there exemptions for veterans?
So I do believe that we've got some conditional exemptions. I am not the subject matter expert when it comes to exemptions specifically. I could take that question down and make sure that we get that with to verify, but I believe that we've got some conditional ones.
Um, Ryan, this might also be for you. Do
Yeah.
employers have a different SAW account for their business tax reporting versus if they need to apply for a benefit for themselves, or can they use one SAW account?
That's a really good question. You do have the ability to do that. Um, you could create one SAW account that is linked to all of the different things, but it can be confusing. Um, and it can be sometimes it's confusing to navigate between the two different accounts on Secure Access Washington. We get a lot of phone calls about that. So sometimes people prefer just to have a separate username, but that's totally up to you. Hopefully that helped.
Yeah, no, that was great. Um, doesn't look like there's any other questions, but if I'll give you just another minute to ask some questions and then we'll continue on to the next few slides. Um, there's a question about pilot programs. I don't know the exact numbers right now for pilot programs. They're changing all of the time, but I can see if we can get you, you can submit your question. I'll put the email address and then we'll respond to you in writing. Any other questions? Ryan, can you go over the items that you're supposed to take off the test file again?
Oh, yeah, we just recommend not, ideally that you wouldn't use like real information because it isn't secure. When you're testing your file through our paidleave.wa.gov site, it isn't secure. When you submit the actual report through Secure Access Washington, it is. So to test it really and to make sure that you have your file set up correctly, you could just use some fake data.
Great, thank you. We do have a question about if there's an exemption for somebody who's over 60, or if they're 60 now, do they have to continue working to qualify? Sebastian, that might be for you.
Yeah, if so contributions began July 1st of 2023. So again, that's when all Washington workers started contributing, and the benefit will be available July 1st of this year, right? So if they were 60 or born before 1968, then they can be eligible for 10% of the benefit amount for each year that they've worked, again, since 2020, July 1st, 2023, um, and can access that prorated amount when they have a care need as well.
There's a question, like a follow-up question about care coordination. I think I mentioned this earlier, but it would be done by a registered WellCares provider. If you have a different question, you can type it in the chat again. And then there's also a question about wages being paid post-death for PFML. You can submit your question to the ESD department because this webinar is about WellCares, and WellCares and PFML are separate, so they have separate answers. Ryan, where can they download or where can they find the test file?
Yes. So if you go to the paidleave.wa.gov website, click on employers, and then file your quarterly reports and premiums. About halfway down the page, you'll see it's step 2. Prepare and file your report. And you'll see the file specifications. We have a template that you can use, and then also the link to test it. So hopefully I got you there.
Any other questions? I have a question about if we're going to have a webinar for providers. We do have a upcoming webinar for providers in March. I'll drop the link for registration in the chat right now. But we are doing one for providers on March 10th, and then we have one for self-employed workers coming up. And we also have a deep dive into Provider One and walkers coming up. You can find all of our upcoming webinars on our website and register there. Sorry, 1 second. I just lost the window. You can find all of our upcoming webinars there. We have a question. Are there exemptions for disabled people who already qualify for Medicaid or Social Security and will not need or use walkers? I think we said earlier, or Sebastian, do you want to take it?
Yeah, I think we kind of referenced this question earlier, but that there aren't any current exemptions, yeah, for that.
Great. Next slide, Sebastian. So, as soon as you close out of today's webinar, a survey will pop up on your screen. We encourage you to take the survey and give us your feedback on how the webinar went today. Next slide. And like I mentioned, you can find today's recording and webinar slides at our website, wallcaresfund.law.gov/webinars. You can contact us via email or live chat at the URL below. And then there's a phone number here for ESD, which would be if you have any specific questions regarding employer reporting, responsibilities, and exemptions, or you can call our DSHS customer service line and we can answer all other questions there. Thank you all for joining us today, and we hope to see you in a future webinar.